Hello, my viewers. I'm Madam Wachira. I'm going to talk about alcoholism and how it affects the person and the family. We are going to talk about what is a drug, what are the effects of drugs and alcohol abuse, family and me as an addict, am I an alcoholic, alcohol and drugs in schools and colleges, factors contributing to students' drug abuse, and what are the preventive strategies? How can I seek help and how can I know I am addicted? We have to determine whether you have a drinking problem, first and foremost. One of the widely used screening tests for the problem is called CAGE. It's either, the first question is, have you ever felt the need to cut down on your drinking? Have you ever felt annoyed when others are discussing your drinking? Have you ever felt guilty about your drinking habits? Have you ever felt the need for an eye opener or drink in the morning at the beginning of a day? That one we call it kutoa lock. And at the same time, if you answer in the affirmative to the above, then you have a drinking problem. And at the same time, seek professional help. And I'm sending this message to sensitize on drugs and alcohol abuse and the way forward and how to avoid all the family's problems, all the jobs problems, dysfunctional families. If you happen to be spending a lot of money on drugs or away from the family, please consult us. Myself, I was addicted for many years, and I am saying this with a lot of soul searching, and I'm doing this because I'm passionate about helping people who are addicted by both drugs and alcohol, as youth, as young people, as older people, as mature people, senior citizens. The addiction has no age limit. Addiction starts with you when you take the first drink or the first sip. That is when the disease of addiction starts in your body. There are people who drink socially and they have never been addicted and they have never suffered either through the family neglect or even the job losses. There are people who take socially and there are no problem, even health problems. People are different, the body makeup is different from one another. But at the same time, if you find yourself drinking more than before, and 3/4 of your money going to finance the drug of choice, then you need to recheck yourself, you need to seek professional help before it gets out of hand. There are so many dangers that happen when you are addicted, and the stages of addiction is from experimental, social use, problem use, and then we call the other stage rock bottom, when you have to get an eye opener in the morning, when you have to get the drug of choice in the morning before you start any job. And that is already a danger. There is always a danger signal on that note, because one uses drugs, one to cover or to hide behind the drinking because the responsibilities are neglected. You have problems at home where duties are abandoned, money, finances are gone astray. Perhaps you have even gotten laid out in your job situation, in your job place. You have warnings here and there, and maybe even your business has run down and totally maybe shut down. We have families who are not talking to each other because, Lord, you may have even sold your father's cows or even other property. to find the drug of choice. And this is where we are saying, at that stage, even long before this stage happens, please seek help so that you don't go downhill. There are so many dangers that happen when you are addicted. You may have occupational hazards. You may be running a machinery somewhere, and then you may even cut yourself or cut others or disconnect the machine unintentionally while the other one is not aware. And we have seen a lot of dangers in the factory when someone has come drunk. You may operate those machines under the influence. You may put at high speed without the other person at the other end aware of what you are doing. You may mess up and even cause fires. The physical head injuries are many because they are falling, kuanguka ovyo ovyo, nyamotaros. You may even have unexplained seizures. You may have vomiting, frequent infections, frequent pancreatic problems, withdrawal symptoms, where we have tremors, we have seizures, abnormally rapid heartbeats. We have also impotence, inability to achieve your desired children, maybe, because 3/4 of the time you come drunk. You are able to fulfill your marital obligations. We have behavioral mood swings. We have depression. We can even have aggressive behavior and beat up their wife and the children. You may have suicidal thoughts and maybe even threats or attempts on suicide. We may have insomnia. We may have anxieties. And you may have regular or prolonged use of tranquilizers or sedatives. You may even overdose on pills. When you are high, the reasoning is poor. And sometimes you overrate your actions. There are people who go to the doctor and they have a sickness. Let's say you may have a sickness on a TB or something. And then you are given a dose to finish the dose, and after 2 days then you realize that you need to drink because of the addiction, and you may drink and then also take the other drugs the doctor gave you, and that can cause body complications. We have also history of increased violence when we have people who are addicted by drugs and alcohol, because you can't reason and you overreact. We have also large amounts of alcohol has also caused liver cirrhosis. And then we have also the cravings where you sweat, and there's also fatigue. There's a lot of bad things that happen to the body, and in a way that you can't control these feelings. Because when you are highly addicted, the cravings will drive you to take a morning drink. And of course, after the morning drink, the day is gone. You cannot go to work, but you cannot perform well. You cannot go listen, you cannot perform the duties that were given to you. And even the reasoning will be distorted. We have as a family, we have divorce cases, and children also are copying what the parents are doing. Let's remember, the children copy very easily what the older members are doing, or the parents or the guardians, and they learn by seeing and acting exactly how the parents are doing. We have also decreased the social life. One person, the person who is drinking or using a drug, he isolates himself from the people. He hides. Then we have financial difficulties. We have also few friends. We rarely even go out, or when we do, we go to our drinking dens. And we have very few outside activities like hobbies, because we are preoccupied with the drug of choice. What are we saying about addiction? Addiction is a killer. Addiction ruins the family. Addiction drug addiction is lethal. If you are dependent on alcohol, in order to function normally, physically, you are now classified as an alcoholic or a drug addict if you are using banging and even heroin or cocaine. You should reflect on how you started the habit. Think of what has helped you to keep it up, e.g., is it your friends that you have been having friends who are using? Think of how you go about your drinking, or are you hiding or drinking it in the open? How do you finance your habits? Are you stealing to finance your drinking habits or the drug of choice? Is your conscience judging you in your behavior? You might find that finding the answers to these questions may help trigger the necessary self-will that will assist you quit the behavior. Ask yourself these few questions and let's see whether we can help you as an addiction counselor. Me too, I had gone through alcoholism for many years where it destroyed me, it destroyed my family. I thank God today that I am able to share about the addiction and how to overcome these cravings, how to overcome the bad habit. We counsel you, and if we realize that you need to be an inpatient in a certain rehab, we discuss the pros and cons with the family members and the guardians. Rehabilitation centers are very friendly. They take you through the Alcoholic Anonymous program, which is a 12-step program, and it is pocket friendly. The people there are friendly, they are trained professionals who are, most of them are in recovery, and even if they are not, they are trained to handle situations and to counsel you and to empathize with you all throughout, where even if there is another problem, because an addicted person may have another underlying problem, we call it dual diagnosis. We have psychiatry doctors visiting the rehabs, and in any case, if you are diagnosed with some other problem, it can be treated while you are an inpatient in rehabs. I want to wish you well. Please call this number. Ask me questions. Ask for maybe an appointment. Let me see how far we can go in answering those questions. I want to help someone who is ready to change. Remember, it starts with you. You started drinking, but that time you didn't know that you would be sick. You didn't know it causes sicknesses. Lakini there is always a turning around. Don't hesitate to call this number, because if you hear my voice, if you have heard this story, please call, give my number to a neighbor whose son is using or the husband is using. Let's help one another, because God wants us to be my brother's keeper, my sister's keeper. Once again, my name is Madam Wachira. I love the Lord. He gave me new life, new lease of life, to help and counsel the addicted people so that they too may enjoy the sobriety and their God-given rights to live a sober, dignified life. Please call this number. My number is 0706 299 454. Once again, my telephone number is 0706 299 454. God bless you all as you live a sober, dignified life the way God wanted it to be. God bless you all.